Good evening to one and all. We'll wait for 5-10 minutes, then we'll start.
Okay, madam.
Good evening. We'll wait for another 5 minutes. Let others also join. Good evening. Can we start? Is my slide visible? Can anyone confirm to me?
Yes, madam. The slides are visible.
Yes, ma'am,
Just
it is
see.
visible.
Can you just see if it's moving? Did it move to the next slide?
Yes, ma'am, yes, ma'am.
Okay.
It's
Thank
moving.
you. I can't help it. I have to do that. Yeah. Okay. Good afternoon, everyone. Shall I start?
Good afternoon, ma'am. Yes, ma'am.
Yeah. Okay. Today is the topic of occupational safety, patient safety, and worker safety. I think we have touched here and there. Little more in depth, which covers the BHME 102 module. Okay. I think we have all spoken that when we are doing healthcare management, healthcare waste management, we need to take care of occupational safety, patient safety, and worker safety. Let's look at each of these things. What are the hazards? We have already know they have various hazards they are exposed to. One is the chemical hazards because of liquids, vapors, gases. Physical hazards could be like your noise, vibrations, extreme temperatures, and radiation. And biological hazards like bacteria, viruses, or any other pathogens. And psychologically, they can be exposed to mental stress and strain. And ergonomic because of poorly designed workstations, if their chairs are not good, and radiation hazards. Now, I think these are the risks and what are the impact of risk and how do we prevent this. I think this table will is very comprehensive and it gives us the idea of what are the different risks we are exposed to, and each of these risks, what is its impact, or what are the damages it can cause to an healthcare worker, and what are the preventive measures we can take. We'll look into that little detail. Now, physical hazards like heavy weightlifting and all those things can result in degenerative disease of lumbar spine. Okay, let's look at each of these. Sharps or exposure to blood or needle stick injuries can cause infections like hepatitis B, hepatitis C, and HIV, and blood transfusions can cause also malaria. For this, how do we prevent? One is the immunization. For that's why our program has hepatitis B vaccination for all our healthcare workers, and post-exposure prophylaxis and also engineering methods so that the risk is reduced. Biological hazards directly because of airborne infections or respiratory infections like you can get SARS or TB, influenza, COVID, etc. So, what is the prevention? Again, mask, the well ventilation, autoclaving before disposal, especially the uh, materials what you use, and also you can use the isolation wards and all those things to prevent these kind of infections. Chemicals can be either vapors or exposures like eye and skin irritation. It can cause weaknesses, exhaustion. So, what is to be done is substitute with soap and detergents and dilute chemicals appropriately so that the damages is less. And physical hazards or heavy weightlifting can cause strain on the lumbar spine. So, for that, some of the places they can use automated waste transfer or mechanical devices for transferring the load. And radiation hazard, we all know it can cause irreversible damage of cells and can lead to lung cancer or leukemia. So, what is best is to compliance to relevant regulations, use appropriate barrier lead aprons, and do such kind of preventive measures. Is my slide moving?
Yes, ma'am.
Yeah, thank you. And coming to the physical hazards, best to be avoided is ergonomics. You design your work task such that it will suit the capability of the workers so that you can prevent musculoskeletal disorders. Simple for doctors, this design of the chairs, okay, how they sit and tables and all, computers and all those things will help them to perform better and also to prevent the different musculoskeletal disorders, especially in software companies. They give very what to say due importance to these kind of ergonomic situations. Okay, and but very less in our this thing, but we need to take care of this as well. Now, biological hazards, as I was talking of SARS, influenza, Ebola web. So we need to have rooms which are negative pressure rooms with door closed. Single rooms better if they have their own bathrooms, and cohort replacement in an area with independent air supply and exhaust ventilation, or turning off air conditioning in such situation. And better to use disposable equipment so that we prevent inter patient transmission or between the healthcare workers also. And patient movement should be restricted and use of masks and face shields as appropriate. And important is again hand hygiene, where we'll always emphasize it's one of the important, simple, effective tool to prevent transmission between people, especially the contact transmissions. Next, sharps. Sharps is one of the commonest in injury we come across in our this thing. Which is the most common one we get? It's not HIV. It is more of hepatitis B, which is the most risk. Okay, if you have some injury, the chances of transmission of hepatitis B is 18 to 30%, whereas HIV is 0.3%, hepatitis C is 1.8%. So this can be prevented by taking necessary precautions while doing the procedures carefully, preventing by using the PPEs, appropriate PPEs, and reduce unnecessary injections and needles also. You can have engineered needles where automatically it will needless devices are coming up nowadays. And destruction of the needles is also is to be done, and prevent reuse of syringes and remove inclination of staff to recap needles. Recapping needles should be completely stopped wherever they are practiced. Okay, that is one of the very commonest what to say procedure or mechanism wherein the person can get injuries. Now, coming to the chemical waste, can cause allergic dermatitis or burns to the eyes and irritation to the eyes and ears. So, preventing is again preventing using the PPEs, gloves, eye protection. If there is radioactive or cytotoxic, there could be ionizing and non-ionizing. So, for that, we need to separate the collection, return to the suppliers, and separate the genotoxic waste from other healthcare waste, and this has to be followed separately. Why this radioactive waste is coming under the bark, that is the atomic energy act, this thing, it doesn't come under the biomedical waste management act. Okay, and maximum protective measures for all the workers. Same, so you should need to have written procedures for safe working methods. Information on potential hazards and minimization. People has to be informed so that they take necessary precautions and establish a procedure if there is a case of spill, and appropriate educate for personal handling cytotoxic drugs and separate collection and transportation. As you have seen, for cytotoxic waste we have a separate cytotoxic symbol, and radiation waste also separate symbol is to be there, and they have to be separately handled with care. So, responsibility of operator, that is the operators who are at the common treatment facilities. Hazards of biotechnology, burn technology can lead to exposure to POPs. POPs is persistent organic pollutants like dioxins and furans, which are very toxic, which can remain in the environment for a longer duration of time. And in the non-burn technologies, the workers can be exposed to steam or hard surface causing burns, and sometimes non-ionizing radiation if they are using any other mechanism. So prevention is basically by use of personal protective devices, educating the people properly that they have to use PPEs. Next is the psychological hazards. We know there will be a lot of stress, especially when in a situation like COVID. I think you realize how much of stress we all went under it. So we need to have structured outreach management program and stress management techniques, because there is a lot of demand from the patients as well as from the community as well, and we need to perform. And we also have a work-life balance which we need to take care of. So adopting stress management at individual level or at workplace is very important to reduce the psychological hazards. Okay, what are the accidents and risks which can healthcare workers? One is sharp injuries, as we have told, spillages or falls also. Okay, and accident reporting includes spillage. Now let's come to the spill. This thing, environmental health injury issues are, they can cause vector. We can have vector-borne diseases, contaminated leach sheet, and animals feeding on healthcare waste. And if stagnation of water is there, it can lead to vector breeding, like mosquito breeding, and rodent diseases also it can occur. So if you dispose our waste improperly, it can lead to lot of environmental health injury, which can affect not only healthcare workers, even the community as well. So responsibilities of occupier to prevent this worker safety is basically to have proper waste management system in place. So ensure waste segregation and labeling. Pre-treat the waste, healthcare waste, which are the pre-treatment of healthcare waste is required at the healthcare facility. Can anyone tell? Just recall which type of waste have to be pre-treated, even though you hand it over to this common biomedical waste facility. Can anyone tell which are the waste which we need to pre-treat at our hospital level before handing over to the common treatment facility?
Madam, from microbiology, laboratory cultures.
Very good. Microbiological waste, laboratory waste. Anything else? Blood bags. Okay, that is one of the other important things. And next, to ensure proper storage and safe storage so that it be secured and it is not having access to any outsiders, and safe transportation of waste within the healthcare facility and also outside. Okay, outside it's a responsibility of common treatment facility, but occupier should be watchful of that also. If they are doing some what to say, miscreant activity, it is a duty of our occupier to see that our waste what we have generated should be safely managed. We are just outsourcing our activity, that's it, but it is our responsibility to see that our waste is properly disposed. And the occupier's responsibility is very clearly, explicitly mentioned in the biomedical waste rules, that they have to ensure vaccination of the people, adequate workers, they have to have workforce, provide PPE, training on hazards, and give all the necessary equipments for transportation so that they safely transport the waste to the within the hospital and outside as well. Now, coming to the bloodborne pathogens, through blood we are one of the things which we can get hazards, right? So, how do we go about removing this? One is elimination of hazard. Complete removal of the hazard is the best thing to happen. Next, like reduce the injection giving only is very important. Wherever injections are not required, not necessary to do. Engineering controls needles that retract so that there is no choice chance of injuries. Administrative controls like putting policies in place, simple anti-hygienic policy, anti-hygienic washing, then PEP, post-exposure prophylaxis policy in place. Okay, hand hygiene policy in place. So put your policies and see to that it is practiced and followed. And work practice controls that will reduce the exposure of the occupational hazards to behavior of workers. For this, we need to put in training in place, then monitoring them and correcting then and there, and see to that there is, while doing the work, they have reduced exposure to these occupational hazards. And last but not the least is the personal protective equipments. So, what are the policies you can have in place which will help in good worker safety as well as the occupational safety? Is universal precautions to be in place or standard precautions? What you say? Use of PPEs, heavy duty gloves or mask, whatever it is. Hand washing, properly labeling also is very important. Putting protocols in place and establishing procedure for disposing of different types of waste. And important is training and retraining. See, one training is not sufficient enough. You need to keep training, on job training, monitoring, so that you correct then and there and retrain and correct them with appropriate knowledges and clarifications. That's about workers' occupational safety. Now, um, workers as their themselves, they have a rights. Okay, there are different rights of workers which we need to keep in mind. Right of workers to be trained, so they need to be properly trained. Okay, and they have the right to work on machines that are safe, and they have a right to be provided safety gear, and right to be protected from toxic chemicals and others, and reporting mechanism for redressal. Just a minute. Hello, sorry. Okay, so these are some of the rights of workers. And whenever we are in healthcare practices, wherever it is, even it's the smallest of smallest procedures, this is the minimum approach prescribed by the in the WHO also. Minimum approach to health and safety practices. One is implementation of standardized management procedures, give hepatitis B vaccination for all the workers, and provision of sharp box to contain the sharps, and implementation of standard precaution, promoting hand hygiene, and allocation of additional role to resume responsible for promoting better worker safety. So these are the minimum approach which will ensure health and safety practices. Now, what are the causes of adverse events which can happen in healthcare? Is one is failure to due to unsafe clinical practice. We may not follow the hygiene practice, or unsafe use of injections, or wrong use of medications and medical devices. Okay, and unsafe processes such as communication failures, ineffective teamwork. That is, there is no coordination between the within the team, and poor patient handovers. I think you would have observed they will hand over the patient handovers from the OT to the wards. There are so much gaps which can happen, which can lead to hazards, and misdiagnosis and poor test follow up, and poor system process with an organizational culture that do not contribute to safety culture of blame. Some blames to I think I showed you a story of somebody, everybody and nobody, right? Culture of blame. I blame you, you blame me, and there's not learning from adverse events, only pointing out mistake rather than correcting such mistakes. So these are some of the adverse events causes which can derail the systems. Now, coming to the important thing, now is the time we are looking for not only worker safety, environmental safety, we are also looking at the patient safety. This is a new emerging area. Patient safety is a discipline in the healthcare sector that applies safety science methods towards the goal of achieving trustworthy system of healthcare delivery. It's one of the important component of healthcare system. Okay, it's just not that we treat the patients, but we also see to that they are safe and they are going out of the our healthcare system. So, what is the objective? To prevent and control healthcare associated infection, improve structural system to support quality and efficient healthcare. We want to give the best quality healthcare for these workers, and also this is can be achieved by give, creating a competent and a capable workforce. Okay, your team should be efficient so that you will see to that our patient safety is given utmost importance, and strengthen capacity for patient safety research. So these are the objectives of research. Now, what are the functions which can contribute to the patient care? One is access to care and continuity of care, protect the patient and the family, right? Management of medications, so they should be taught about medications properly, care of patients while in the hospital, and continuous quality improvement. You must always aim to improve your quality, not just one time and leave it, and as much as possible prevent and control of hospital acquired infections, and good human resource management, like having good team play, then good leadership, all these things, and information management system, and event reporting and surveillance. Keep a watch as what's even the patient satisfaction also comes here. Okay, look at them and see how it's going, improving or coming down or stagnant, which will help you to perform better. So, how do we prevent adverse events for the patients, especially? Is first is risk management, identify and reporting safety issues, and patient safety team, and incident reporting and patients. I'll come to this little later. So, for all your hospital accreditation, this is one of the important standards which we are looking at. Patient-centered standards is given a very good importance. Healthcare organization, it's part of healthcare organization management standards. So, we need to not only prevent errors, if at all if errors are occurring, we have to report that and keep a watch, and try to see what caused it and try to correct it. It's not nil reporting doesn't mean it's not there. Maybe it's not reported also, but that is also not good. So at the global level, there are a lot of campaigning, patient safety campaigns are going, and there are so many things which we are looking at. One is the safe injections, blood safety policy, safe surgical care, safe childbirth, safe organ transplant, medicine safety, and medical safety device. Okay, so this broadly we have talked of the occupational safety, environmental safety, and worker safety. Now I'll go in depth little bit on personal protective equipment, hand hygiene, and PEP to complete the which will ensure all these safeties. Now, personal protective equipments, I think we have all discussed. This is also known as PPE very commonly. Is equipment that protects the user from the risk while working. So, importance is it has to be worn while handling healthcare waste, especially while handling healthcare waste. It's very important. Can you identify what is the mistake? Any mistake here, or is it good? Are you all okay with this?
Ma'am, a radiological hazard sign is there on the yellow bag.
And which one? No, that is biohazard symbol. No? That's biohazard symbol. Radiological hazard, I'll show you 1 minute. 1 minute, I'll show you how radiological waste hazard will be there. I'll show you all the three symbols, just give me a minute. Just give me a minute. Just a minute. I think only three of them, if you know it's good enough, I'll just put those symbols. Okay. Sorry, I'll project it. Can you see this?
Yes, ma'am.
Yeah, this first one is the biohazard symbol, second one is the radioactive waste, third one is the cytotoxic waste. So don't get confused. This picture is okay. Okay, the person who is handling waste is okay. These are the symbols which you must keep in mind. First one is biohazard waste. This is second one is the radioactive waste. Last is the cytotoxic waste. Okay, now why we need to use PPE? We all know it will protect from sharp injuries. It will prevent direct contact with blood and body fluids, and also exposure to hazardous chemical substances. So it acts as barrier against our infections or exposure to chemicals. So you can use components of PPE. We can decide for the patient, healthcare workers, especially who are handling waste. They can decide they can use only face or face mask with shield, okay, with gloves, and they should wear heavy duty gloves, not the regular gloves. Okay, plastic aprons, scrub suits sometimes we may require, and this is heavy duty rubber gloves, not the normal shoes, and disposable gown while especially transporting the waste, face mask or and cap, face shield if required. If they feel there is some exposure splash which can occur, there such places we can use face shields, goggles if required. Okay, so and those who are working with incinerators, all these equipments are required, like helmet because there could be injuries, burns also, safety goggles, respiratory masks also, heavy duty heat resistant gloves, aprons, scrub suits, and heavy duty heat resistant boots. Okay, and either the occupier or the operators. Okay, in a healthcare facility we call them as occupiers. For operators we call it for common treatment facility. They should provide regular health checkups, PPE, and training on the use of PPE. Sequence of wearing PPE. uh, First thing is to, I think, hand hygiene, which I don't want to emphasize again and again. It's one of the important thing. All the 10 steps we can follow and ensure it is clean, your hands are clean and safe. Then wear the scrub suit and boots, gown, then mask. If required, put on face shield or goggles, and then head cover, and again perform hand hygiene. And last thing is the gloves. Okay, usually this is the way we reversely remove our PPE also. I think most of us and wear place waterproof apron over the gown. And I think COVID has given an opportunity for us all to don and doff our PPE very effectively. Sequencing of removing, again dispose of the apron safely, and then remove the gown, gloves which have to be rolled from inside out, then remove boots without touching them, hand hygiene. Every step, in fact, while removing PPE, every step of removing the personal protective equipments, we need to do the hand hygiene. Okay, remove face shields and then again hand hygiene, remove mask, hand hygiene. Okay, and then afterwards PPE should be removed after the healthcare worker. Waste time is no contact with the waste, and dispose all the plastics into red bin. all the other waste into yellow bags. Okay, this is the precautions we must take in. During the PP work, what happens? Care of PP, that I told, doffing and on. While working, sometimes so happens our PP gets soiled or torn or damaged. What should we do? We must immediately remove the PP as soon as possible. Wash the affected or exposed area with thorough soap and water, and again replace the PP. If you use prolonged use of PP, contamination of work environment and risk of infection to workers, patients, and visitors is possible. Single or reuse of PPE, depending on the institutional guideline, PPE can be used single use or reusable PPE. And if the PPE is reused, okay, disinfect properly and properly stack for future use so that it is not contaminated. For example, sometimes gloves, heavy duty gloves, we do not dispose it every time. Okay, we have to properly disinfect, dry it, keep it properly, and reuse it whenever we want to use it. And personal protection should be used at all times of collecting, transporting, and storing and disposing the healthcare waste. Okay, coming to the hand hygiene, few slides on hand hygiene. Washing hands. What is hand hygiene? It's washing hands with plain or antibacterial soap or water or using alcohol gel to decontaminate the hands. Okay, any of this is called as hand hygiene. And if you do not do the antigen, the chances of hospital acquired, this is the pathogens which are seen on our hands. Okay, the cocci you can see, and prevents the healthcare infection. I think these are the important 5 moments of hand hygiene when we are supposed to do before touching any of the patient or before doing any procedures or clinical or aseptic procedures. Next is if there is any blood or body fluid exposure, we have to wash our hand wash. Now after touching a patient, we must do that. And after touching patient surroundings also, we must do this. These are the 5 moments of hand hygiene we must all keep in mind so that we prevent infection to ourselves as well as to prevent cross contamination between the patients. So other occasions where we need to practice hygiene, apart from this is for our own safety. Immediately after arriving to work, you can do that. Always after handling healthcare waste, after removing any gloves or coveralls, or after using your toilet, before eating, after cleaning up a spill, and before leaving for work. Make it a practice that before you leave your work, completely wash your hands thoroughly and then leave to your house so that you're all safe for your own family. For hand hygiene, as a doctors and as a healthcare professionals, we must all remove all jewelries on arms and forms, especially when providing patient care. Keep our nails short and without a nail polish is better. And wear clothing with short sleeves so that you do not get contaminated. Okay, techniques of hand washing, I will not go into the details of this. So, can anyone repeat for me? Hand hygiene, hand washing technique? Yes, anybody can tell me the steps of hand washing? No? Okay. Wet your hands with water. Apply enough soap to cover all the hand surface. Then first step is to rub hands palm to palm. Then right palm over left dorsum with interlaced finger and vice versa. Then again palm to palm with fingers interlaced. Then back of fingers to opposite palms with right finger with fingers interlocked both the sides. And rotational rubbing of left thumb clasped in right palm and again on the other side. And rotational rubbing backwards and forwards with clasped fingers of right hands in left palm and again on the left hand in the right palm. Okay, and then rinse hands thoroughly in water. Dry hands thoroughly with a single use towel. Use towel to turn off the tap, and then your hands are safe. Now, when hand hygiene should be done? When hand wash has to be done. Remember to always wash your wrist during a hand wash, and remember to wipe the hands after a hand wash with paper wipes. And whenever it is visibly hand rub and hand wash, visibly dirty, we must go for hand wash. Okay. Now, common areas that are missed during hand wash, which you must all concentrate, is on your fingertips and the thumb, around the tongue. And frequently missed, you can see that thumb, ulnar, thenar areas, and interlocking areas. So that is the reason our 10-step bandage in practice, if we follow thoroughly, it will take care of these areas which we are likely to miss when we usually wash. When we wash our hands, we don't take much detail as usual. But when we are taking care of the patient or in the hospital setup, I think we need to follow the 10 steps. In fact, I think in schools are teaching this 10 steps. When they are teaching that, it means it's emphasizing so much of its importance. As a healthcare provider, I think we need to follow this simple but very scientifically proven method of prevention. So, hand wash is the single most important activity to prevent infections and to keep ourselves safe and also the people whom we are treating. Next important thing is post exposure prophylaxis. I think I spoke in the last class when I took the class. Anyway, to for our benefit of this thing, it could be infectious hazards that a worker is exposed to is one is the sharp injury, the other one is the blood spill. How do we manage this? What are the things it can cause? It can cause hepatitis B, HIV, or hepatitis C, or tetanus as well. Okay. So, which are the blood fluids that are considered at most risk is the blood, semen, vaginal secretions, cerebrospinal fluid, synovial fluid, peritoneal fluid, pericardial fluid, amniotic fluid. So all these fluids are considered to be risk and they can transmit any of the infections which we labeled before. So again, the risk of infection depends on amount of infection material involved in the exposure, how much is the virus present in the source of the blood, and whether the person who was exposed has taken the PEP within the recommended time. So, type of exposure poison one, it could be injury with a needle or sharps, or it could be splash, blood splash, or the amniotic fluid splash onto the eyes or mouth, especially when labor procedure, you can get anticipate this. And contact with non-intact skin, if the skin is chapped, abraded, or having dermatitis, and prolonged contact with intact skin also is a possibility. So how do we protect? Wearing appropriate PPEs, could be gloves, gown, apron, cap, mask or shoes. In case of possibility of splashes as well, use your goggles and face mask or shield. Okay. Many of the labor rooms they use this PPEs better for their own protection. What are the immediate things you must do? I think we showed the videos last time, right? Did I show the injury, needle stick injury, occupational safety video? Anybody could recall, or you want me to show it again? I can show it after the class. I'll
Okay,
show again.
yes,
So,
ma'am. Yes, ma'am.
okay. If there is splashes, any needle cuts and cuts should be washed under running water, and splashes to the nose, mouth, or skin should be flushed with profuse water or normal saline. You can clean, or eyes also should be irrigated properly with clean water or normal saline or sterile irrigants. And any of these events must be immediately informed to the immediate supervisor who are there in the workplace so that we can take necessary actions. Remember not to panic, not to use antiseptics, not to use soap or disinfectant. We do not recommend any disinfectants for mouth splashes, and do not squeeze injury site. Okay, it's not recommended. And do not put your exposed or cut or bleeding finger into the mouth as a reflex. That is a common thing which we do whenever there is injury, to put your hands in mouth into your hands. Sorry, hands into your mouth. So don't do that. And any such things must be as documented as needle stick injury. If there is a bigger accident, it must be reported to the pollution control board on form 1. Bigger accidents means it means like there is a uh, accident of the vehicle which is transporting, or huge blood spillage. Those things have to be reported to the pollution control board within 24 hours. Okay. So these are some of the occupational safety measures which we need to keep in mind so that we can go back home safely and also ensure patient safety and anniversary. I like this statement. I would like to conclude with this. Let the waste of the sick not contaminate the lives of the healthy individuals. Any questions at this point of time? Any questions?
No, ma'am.
No. Okay, thank you. Now I'll play that occupational safety video. Okay, I'll put the occupational safety video. I don't know whether it's a repetition, but anyway, I don't. It's okay, no problem. 1 minute, 1 minute.
Safety.
I think you have seen, right? Okay.
Occupational safety. Healthcare personnel and workers handling waste may encounter hazards and infection risks as
Are
a
you able
result
to
of
hear
their
this?
occupation.
Can you see and hear the video, please?
Yes, madam.
Yeah. Thank you.
Occupational safety. Healthcare personnel and workers handling waste may encounter hazards and infection risks as a result of their occupation. It is therefore necessary to prevent and control these risks. All healthcare facilities have a responsibility to ensure the occupational safety of healthcare personnel. An occupational safety program should include provision of personal protective equipment, regular health checkup of all healthcare workers, immunization, management of accidental exposure to blood and body fluids, training, and documentation. Personal protective equipment. Personal protective equipment are specialized clothing or equipment which act as barriers against infectious materials. It should be made available to all personnel who collect or handle waste. The following are to be used by all those who handle biomedical waste: cap or head cover, mask, goggles or face shield, gown, gumboots, and heavy-duty gloves. Regular health checkups. According to Biomedical Waste Management Rules 2016, all healthcare personnel, including waste handlers, must be provided a medical checkup at the time of induction and thereafter once a year. Immunization. All healthcare personnel should be immunized with hepatitis B vaccine and tetanus toxoid. Management of accidental exposure to blood and body fluids. Remember, recapping is a wrong practice. It can lead to needle stick injuries. Occupational exposures to blood and body fluids can also occur through spills and splashes into the eye or mouth. When such an occupational injury occurs, do not panic. Do not put the finger into your mouth. Do not squeeze the blood from the pricked finger. Do not apply any disinfectant. What you should do is remove gloves and place hands under running water for 5 minutes. Collect blood from the source and the exposed person and send it to the lab for HIV and hepatitis B testing. Record details of the event and its follow-up in the injury register maintained at the hospital. Start post-exposure prophylaxis for HIV, preferably within 2 hours and not later than 72 hours. The exposed person must also be provided with psychological support by a counselor. Training. All healthcare personnel and waste handlers should be trained on biomedical waste management on an annual basis.
Um, had I shown you the blood spill management video?
No, ma'am.
Okay, I'll play that also. Have times one ping. Okay, 1 minute.
Blood and body fluid spill. Blood and body fluid spill management. Blood blood and body fluid spill management. Blood and body fluid spills need to be managed with utmost care to prevent exposure to infection. Every nursing station must contain a spill kit. The spill kit should contain disposable apron, gloves, mask, absorbent material, disinfectant, mop, yellow and red plastic bag. In the event of spill, the following steps need to be followed. Step 1. Cordon the area and place a caution board. Step 2. Open the spill kit and wear the personal protective gear. Step 3. Cover and clean the spill with a paper towel or any absorbent material and discard into yellow bag. Repeat the process if necessary. Step 4. Cover the spill area with sodium hypochlorite and wait for at least 20 minutes. Step 5. Wipe the area with paper towels and dispose them into the yellow plastic bag. Step 6. Clean and mop the area as per regular housekeeping practices. Step 7. Remove the personal protective equipment and dispose it appropriately. Step 8. Wash your hands. Finally, refill the spill kit for the next use.
Okay. Okay. One more mercury spill management. This is my last class. I thought I'll utilize this to show you these videos. It will be useful for you.
Mercury spill management. Mercury, a heavy metal that vaporizes at high temperatures, is commonly used in medical instruments like thermometers and sphygmomanometers. Every nursing station must be equipped with a mercury spill kit to handle accidental mercury spills. In an event of mercury spill, follow these steps. Place a caution board and cordon the area. Remove all jewelry and wear the personal protective equipment like face mask, gloves, apron, and shoe covers. Do not use vacuum cleaners or brooms to collect any spilled mercury. Locate all mercury beads using flashlight and bring it together using cardboard or X-ray sheets. A syringe or sticking tape may be used to collect the leftover mercury beads. Place the collected mercury in an airtight plastic container half filled with water. Label and send back to manufacturer for recovery. Place all the material used during the cleanup into a leak-proof plastic bag and send this to the hazardous waste treatment, storage and disposal facility. Do not discharge any mercury into the drain or sewer. Keep the windows open to ventilate the area after cleanup. Wash hands thoroughly after cleaning. Phase out mercury from all hospitals to avoid the harmful effects on human health and environment.
Okay. That's it from my end. Any questions you have got? Any questions from your end? Not,
No,
I just summarize one video is there.
Biomedical waste management. Biomedical waste, if not managed properly, can be harmful to human health and environment. Biomedical waste management in a healthcare facility should be managed in a life cycle approach. It should focus on meticulous segregation, proper disinfection before disposal, safe collection, transportation, and finally, appropriate treatment and disposal. In the entire life cycle, segregation at source is the key to effective biomedical waste management. Biomedical waste management is an environmental safety issue, patient safety issue, and occupational safety issue. More importantly, it is an attitudinal issue. We generate waste, and in the interest of humankind and the environment, we need to manage our waste responsibly.
Okay. Okay, if no questions, we can call it a day. Any questions?
No, ma'am.
Thank you, everyone.
Thank you very much.
Thank you, madam.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you. Thank you.